with the jaw, it's not as simple as just a singular joint. There's nerves, there's like actual bony structures of where the jaw sits in. So with improvement of that, it's nice that you're going to see those changes, and then if you notice opportunities with opening further, with less hesitation, that's going to be a nice thing as well. What's going on with the clarity in your voice with the singing? You had mentioned last time.
No, it's definitely noticeable. Just in terms of, I think I'm opening my mouth wider, which is always better singing. Letting more air in and sort of creating more sound, and I hear more volume in myself, and it's easier.
So you can actually, from hearing it, helps you to resonate the singing.
Yeah,
that's
definitely.
good. So you would have difficulty hearing like an echo back before.
Sometimes, yeah. Or it just took more physically to produce enough volume for that to happen, which is what should happen. But it just, for a while there, was taking a lot more effort to sort of, sometimes singers say it's like you're singing through a wall.
How about the ringing in your ears? Any changes with the tinnitus, or is that still?
I don't know. I think that's there, but I have definitely made progress with the feeling of this ear being plugged. That I don't.
So that's no longer.
That seems to be
good.
Common.
Any changes with your CPAP at all in regards to the numbers?
Nothing noticeable yet. They were pretty, like I said, as I said, they were pretty low anyway. So no, nothing drastic there yet.
Okay, and no changes, any changes with the acid reflux at all?
Possibly. Not that I know. Like I said, I'm medicated for it, so as long as I'm medicated, I don't notice the symptoms a lot to begin with. I would almost have to sort of maybe test myself and skip a dose one day or something to see how it works.
We're not going to specifically treat that condition, but the purpose of the CFR, even though our focus was to help with sinus obstruction and difficulty with breathing, it's really there to stimulate brain function, because the skull itself houses the brain, and if the skull is restricted, it physically impedes the brain's communication to the body. Tomorrow is we're going to reapproach the two middle sinuses, which were the ones that were a little bit more restrictive. And what it will do is, we gave it a numerical number on difficulty, 5 being the worst and 1 being the easiest. We'll be able to go back and see, is it the same difficulty or easier in regards to its movement? And then I'll discuss with you some things in regards to if you're noticing any other changes. And take a look also if you have any pictures from the past few weeks, because the eyes primarily are less swelling, and that's at least me just seeing some things. And it's one of the most common things, that swelling in the face is generally a secondary effect of the skull not moving properly. So